Okay, let's get started. Hey, everyone here should know, if you don't already know, Anthony LaPolla because he's amazing and he's a friend of Granite Peak and should be a friend of yours. He is with Empower. They have an amazing company. They have a new logo, same great company for all of your HR needs, for all of our HR needs. He's been with us before, always a crowd pleaser. If you guys have questions in between, because we're talking about handbooks, I know that handbooks are near and dear to me. If you guys have ever had a conversation with me and I say, what does your handbook say? This is what we're here for today. So I'm sure there will be questions coming through. Pop them into the chat and we can get to them when Anthony comes to like a natural stop and we'll go from there. But Anthony, I'm just going to intro. Let's talk about handbooks.
Well, thank you, Megan. It's good to see everybody on the call and those who have joined us this afternoon. Appreciate you all. I know how exciting handbooks can be for your your clinics and organizations, and it's one of the hottest topics right now within the HR space, and especially those that either haven't updated a handbook in a long time or are just starting a clinic. And it's really that time of year as well to start looking at handbooks as a whole, especially if you're looking to roll out a new handbook within quarter 4 or at the beginning of next year. So, one of the things that we're going to be talking about today is what the handbook should entail and some of the things that we should be staying away from and looking at uh, as you start creating one or need assistance creating one. These are the areas of a handbook that we should be looking at. So, any questions, like Megan said, please feel free just to either put them in the chat. I know we have a bunch of people on the call today, and please feel free to stop me at any point in time if you really want to get a question answered. But if not, we can always wait till the end of the webinar as well. So looking forward to this afternoon with you all, or this morning, depending on where you are in the country. I'm just going to share my screen here. Let me know once you see it. Good. Awesome. Megan, I'm going to keep you up in the very top corner here, not in the center, in the corner. And we'll get started. So, Handbooks 101, Employee Handbook Essentials. Again, talking about what the essentials are for an employee handbook and the areas that you should be looking at for your handbook as you start building it out. So, why does a handbook matter for your organization? Well, while it's not required by law per se, it is a good document to have and a good reference for your employees and you as an employer. So, what are the primary benefits of having a handbook? Legal protection in a workplace. It does have consistent management decisions across the team. So anything that you all decide, whether it's time off policies, attendance policies, specific policies related to the clinic itself and to your organization, you'll want to make sure that you put those into your handbook as well. Looking at reduced unemployment claim risks, clear expectations for every employee, and a documented defense in an agency investigation and claims. Megan has heard me say this before in other presentations, but document, document, document. That is my saying, my words that I use every day, multiple times a day, must document. So we can go into what documentation means, what documents and documentation that you should be doing in your clinic, from disciplinary actions to employee relations to workplace accommodations, all so forth. But we'll get into that a little bit later in our webinar this afternoon. Many small businesses and practices still operate informally. And what that really means is, well, yeah, I told them that they need to do this, or I told the employees, yeah, we should have a PTO. I told them what their PTO is going to be, or I told them what the benefits are going to be. Well, again, if it isn't documented, it's difficult to defend. And that's really where an employee handbook will become really your go-to reference guide, essentially, for your organization and for your employees to reference as well. What a handbook is and is not. And there's a lot of confusion around these two, right? So, a handbook is a policy and expectations guide. It is not a contract. Okay. Contracts, employment agreements, offer letters, completely different than what a handbook is. It's a compliance reference. It is not a promise of continued employment. So what that means is it should have state and federal guidelines. It should have your organization's policies and procedures, but it is not a promise of constant and continued employment for as long as you're employed with an organization. And then it is a leadership tool. And what I mean by that is that when you are managing staff or when you're managing employees, having that handbook to reference on expectations for the employee's job or for what's expected from an employer standpoint. It's a great tool to reference. It does not guarantee pay or benefits. Again, pay, benefits, anything negotiated during an employment offering is part of an offer letter and or employment contract. Any questions on that thus far? Okay. At will employment and disclaimers. So most states follow at will employment. That does not mean you can just fire at any time. And I think that there's a lot of misconception that, well, my state's at will, so I could just let go. Well, you really can't, and you need to have proper documentation when it comes to at will employment. But when you're looking at building out your handbook, you want to ensure that you have that at will employment and disclaimer clause built in to the handbook itself. So again, most U.S. states follow the at will employment, but there are rules and exceptions and required language that is very state specific and could be based on locality. So for example, let's pick the wonderful state of New York. New York operates as a state, right, and has state laws and regulations. But if you're located in New York City and in the five boroughs of New York City, there are also New York City rules and regulations based on that five boroughs. Same thing with Philadelphia. State of Pennsylvania operates. There are specific laws regarding the Philadelphia proper. Same thing with county laws. So you have to make sure that your employee handbook that you create is also specific enough to where your actual entity address is for your clinic. So make sure you keep that in mind. Okay. Statements to consider in an employee handbook. Employment is at will, but again, make sure you're following that. Either party may end the relationship at any time. There's no policy in the handbook that creates a contract. Again, contracts are completely different. And the employer can change a policy at any time. While we recommend that employers should update their handbook annually, you can update it twice a year. I've seen people update it monthly. You don't want to do that because one, it's an administrative nightmare, but two, it also causes and can cause confusion, not only for you as the employer, but for your employees as well. Okay. Again, why does this matter? Courts in every state read handbook language closely. So if you were to ever get called by an attorney, if you ever, unfortunately ever found yourself in an investigation or a lawsuit, the first thing your attorney is going to ask is, where's your employee handbook? What was acknowledged in the handbook? What did you write or how was it built out? Okay. Any questions thus far? All right. So when we look at a handbook, there's a core handbook sections that really should be included. Now you can always add and tweak, but for the sake of our call this afternoon, I really wanted to just break it down to the 10 areas that are the most sections that really need to be looked at when building out a handbook. On average, a handbook should be anywhere between 50 to 70 pages long. And I say this because we will review handbooks and build out handbooks or hear, oh, our clinic's all set. We have no problems. Our handbook's built out. Great. How long is your handbook? Before I even review it and do an audit, I just ask, how many pages? It's 22 pages. Not long enough. Can guarantee you that state and federal laws are not even in there based on when your handbook was created. I will also say this on the record, Megan and team, that stop AI chat GPTing your handbooks. It is not good. There are a lot of misinformation, and information that is not correct within handbooks. A perfect example, we just worked with a clinic out of Maryland that needed a handbook redone. We started to do a handbook. The owner said, "You know what? I'm just going to use AI. We're going to have the handbook done." Okay, no problem. 4 months later, they gave us a call that they're in a lawsuit because the handbook that they created, they didn't really review it and trusted what Claude or ChatGPT provided, and it was for the state of Texas and had Texas law in it intertwined with Maryland. And so when you're building out handbooks, please, 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 please do not use ChatGPT. Do not use it to build your entire handbook from start to finish. It will cause issues at some point within the agreements that you're asking your employees to sign. Okay. So let's start with welcome and mission. You really want to have that whole welcome and mission of your handbook built out. It's a good way to welcome staff, having a clear identifiers of what's expected out of the handbook and what's expected for the clinics that they're operating out of. It's a great way to put your mission, vision, values if you have them. I think it's really good to have the employees read those and acknowledge that this is what and who you are about. And so having that part of the employee handbook is wonderful, and it should come directly from you as the owner or practice manager of the clinic. Um, and make it heartfelt. Don't make it so AI driven or robotic sounding. Make it heartfelt and have them be greeted well when they open the handbook for the first time. Okay. Uh, when we look at employment basics, things that we want to make sure we're including, definitions around full-time versus part-time, exempt versus non-exempt, salary versus hourly, exempt equaling salary, non-exempt equal hourly. Make sure that you have clear classifications around those, especially if you were to get audited by the Department of Labor. They're going to want to know, what is your classification of exempt? What is your classification of non-exempt? Um, Introductory periods. It's always good to have an introductory period if you do use them. For example, 90-day probationary periods, let's say, for somebody that's being hired. It's good to have that in your handbook, and it's also good to have that in your offer letters and contracts. And then also good to have transfers and promotions. What does that look like? You could even put something as unique as your annual raises. If you do annual raises, a lot of times practice managers and owners will get caught off guard in the middle of a day, right? Hey, I didn't receive my raise this year. Well, wait a minute. What does that actually look like? What does that mean? And so we want to make sure that we call that out clearly in the handbook around policy, process, and procedure when it comes down to any type of transfers and promotions. One of the common risks in this area of your handbook, again, is that misclassification. There are, we're looking at 1099s right now. 1099s are a big thing, right? For misclassifications in veterinary clinics. Misclassifications of employees. Who's truly part-time? Who's truly full-time? One of the biggest hangups that we hear is if you offer benefits in your organization, there is a full-time benefit hourly, and then what is required by the clinic hourly. So what I mean by that is, well, our staff is full-time because they have to work at least 32 hours to get benefits. Well, that might not really classify as a full-time employee. What do you classify as a full-time employee for your organization? Well, we classify our organization as 40 hours. Okay, that's what the employee should be working as a full-time employee. And maybe anything under 35 hours you classify as part-time. You have that ability to do that. I call that out because a lot of times owners, practice managers get hung up on, well, I thought 32 hours was full-time. Benefit eligibility and what you classify as full-time for your organization, two totally different things. And we just want to make sure we call that out, especially call those out in these two areas between employment basics and then in your benefit eligibility. Any questions thus far?
I do.
Yes.
Um, great. I wanted to talk about this. So, what are you seeing? Like, what's the average, the new average for full time at the practice level?
Average of what we're seeing is 35 hours a week. That's usually the average for full-time staff. But again, it depends on whether you're GP or specialty or emergency ER and how you structure your shifts. But if you are, I'm going to do air quotes, normal GP Monday through Friday, 8 to 5, or eight to 6, and how you structure staffing, usually around 35 hours is a full-time equivalent.
And just to clarify, you can have a full-time employee at 35 hours, but you can qualify for benefits at 32.
Yes, anywhere between 30 or 32, all depending on what your carrier states for benefits. So it all depends on whether it's United, Blue Cross, Kaiser, whoever it may be. They're the ones that will dictate what the requirement is in order for somebody to get benefits within their carrier ecosystem. So it could interchange either 30 or 32 hours, anywhere in between there.
Does that get confusing to have 30 hours and 40, 35?
Um, it gets confusing for owners because they get hung up on benefit eligibility versus full-time staff. So I always say, what are the needs of your clinic? We need somebody here 35 hours a week. Great. That's what you should be advertising or telling people as full-time for the clinic itself. Um, Again, I think that hang up is that benefit eligibility class, what's full-time and what's not.
Yeah. Okay. Those are my questions. I don't think anyone else has any questions at this time.
No, that's perfect. Thank you.
Thank you.
Pay and timekeeping. So this is a little difficult in veterinary medicine, and the reason why it's a little difficult is because in a perfect world, you should be managing timekeeping and pay through a payroll system, an HR system. That's usually the cleanest and easiest way if you were to ever get audited by Department of Labor or your unemployment insurance through your individual state, right? But because we are in vet med, we also track time in our PIMS. So there's a lot of times where um, employers or clinics will not use, I'm going to pick on ADP, Paylocity, Gusto, whatever it may be, to track your time. And they say, nope, we're tracking it in Shepherd, we're tracking it in Covetrus, or we're not utilizing the time clock and we're tracking it in when to work or when I work. That's great. That's fine. As long as you are keeping time for employees to clock in and clock out. So when we look at a handbook, we want to make sure that you have the general wage and hour requirements. So you always want to make sure that you're calling out in your handbook, okay, your pay frequency, whether you pay weekly, biweekly, semi-monthly, make sure that's stated in there. You want to make sure that you also have final payroll. So every state is different on when someone is terminated or someone resigns from the clinic, when those final rules are. Perfect example, California, somebody leaves, they have to get their final paycheck that day. In New York, it's not. If someone leaves in the middle of a pay period, they don't need to get paid that exact day. They get paid the next following pay date. That is that is the requirement based on the state needs. So whichever state that you're in, you want to make sure you just call that out in your handbook that if you were to leave, if you were to resign, if you were terminated, this is when your final paycheck will be. Accurate wage and hour records. And what I mean by that is if you are requiring, and you should be requiring, your staff to clock in and clock out, you have to make sure you're calling that out in your handbook, and it is a requirement. Why is this important? It's important because we want to protect you from time theft in your clinic. We want to protect people saying that they're at work and they're at Dunkin' Donuts down the street getting a coffee and they are saying they're clocking in or that they're working. So we want to make sure that if you are requiring your staff to clock in and out, no matter what system it is, that they're actually on site and that they're actually doing it. Now, in the world of technology today, there's the apps of clocking in and out. Some clinics love it, some clinics hate it. I am a big proponent of clocking in while you're on site at a computer. It's it's easy. You set up your own time clock, boom, there you can actually know when Megan's at work and she's clocking in, right? But there's a lot of times where it can get a little weary and it can be a little difficult if they're using an app. However, you allow staff to clock in, just make sure you're calling out, please clock in via our time clock system or via the app making sure that that's in the handbook. Overtime. Overtime per the Federal Fair Labor Standard Act, FLSA. I won't go down too much into the weeds of FLSA, but there are wage requirements. There are requirements on who can be exempt and non-exempt. These are areas that you really need to focus on and to ensure that you're paying your employees appropriately and fairly based on the FLSA. Who is eligible for overtime, who is not eligible for overtime. You should not make somebody a salaried employee if just because they're working long hours when really they should be an hourly employee. So please make sure that you're keeping that in mind, and please make sure that you're calling out any type of overtime laws and rules based on your state. Some states is anything over 40 hours within, I'm sorry, yes, anything over 40 hours within that week, or if they work more than 8 hours in one day, if they work an extra hour that one day, they might get overtime. So every state is different based on those laws. Again, common risk areas, off the clock work, early arrival for prep or setup if they're not clocking in and out, late stays to finish urgent work and or we've seen it supporting in doctor's notes and such and cashing out clients. And if they're past what they're supposed to be scheduled, making sure that it's reflected appropriately in the timekeeping system, whichever timekeeping system that you're using. And then volunteering. Nobody should be volunteering outside their hours. Yes, this is real. Yes, just had this conversation last week. Well, they want to volunteer past their time. Nope. They were working that day. They were on the clock. They need to be paid for the work that they're doing. Volunteering outside or volunteering if the employee wants to do it on their own for nonprofit charity, if they want to do something to support and they want to volunteer the time, that's one thing. But if they're actually in your clinic and they were performing work and their schedule is supposed to end at 6 p.m. and they want to volunteer time afterwards, no, they need to be paid. All hours worked must be paid. That is the golden rule. Any questions?
Yeah, I have a couple, or just two things.
Yes?
One is having clinics that are in hospitals that have more than one location, and sometimes they might be right by the state line. So there we have one client like that. So they have employees who work in two different states, during the same period of time. I just think of the importance of having the employee handbook that would cover the laws of both states because sometimes they get really mixed together, and it's interesting on the paychecks as well. So that one item I was just curious about, and then just so I don't forget, the other one is along the lines of volunteering. I've definitely come across that as well. But in addition to volunteering, they'll maybe pay the employee like $300 because they did a special project for them that wasn't part of their normal job. They helped us paint the room, one of the exam rooms, and this is, they're a whatever. So it wasn't part of, they didn't feel like it was part of them being an employee, and they just wanted to pay them a couple $100 to,
Mhm.
to a project that wasn't part of their employee role. So yes, have come across a couple of those things. Just whatever what your comment might be, or maybe how to address ensuring that's noted in a handbook that those things shouldn't be
Sure.
part of it.
Um, your first comment question on the handbook. So your handbook, if you have employees in multiple states, your main handbook should be where the organization is, where the entity is, it is in that state, right? So if I'm in New York, my handbook should be New York based. If I have an employee that is working in another state, you have to have a state addendum and a handbook addendum for that state. So not only would the employee receive that handbook, but also get the addendum based on the state rules of where they're working. Most of the laws will fall under where the entity is, but if the employee is working in another state, we want to make sure that we're covering those state laws. So that's great comment, great question on that. Regarding the volunteer,
Wait, can I kind of add one more thing?
yeah,
What the locations? There's physical locations in the two states. So like maybe the staffing company that hires
yep.
the employees, but then the truly the physical buildings are in different states.
Yep, it's not necessarily where the physical buildings are, it's where the legal entity is. So if the legal entity is in that state, you're going to want to build it around that, and then you could have multi-locations based on if you have multiple locations in different states, then you'll just want to make sure that you're covering that addendum through the handbook that says we also operate in Pennsylvania. Our main is in New York, but Pennsylvania, we have another location. So we'll want to make sure that those addendums are clearly defined and to show that not only are you protected from an employer standpoint, but from an employee standpoint as well. Great. That's a very good question. Really quick on the volunteering. Totally agree. Should not be doing a stipend. They should be getting paid their hourly rate if they are in the clinic doing some painting after they're paid that hourly rate, if the owner wants to bonus them out as an additional, absolutely, that's fantastic. But just to give them a flat rate stipend to say thank you, no, we want to make sure that we're actually showing. And the reason being too is, God forbid they got hurt. The workers' comp is going to say, well, were they clocked in or were they clocked out? Were they actually working or were they not? So you also have to think about the insurances side of it and the liability side of it as well. It's more than just pay.
Mhm. And to ensure
Which
it runs through payroll and
That's
not just cash on the side.
that's correct. Don't use the petty cash, please.
Right.
Please don't do that.
segueing into a great question that came in, any
Yeah.
insight on employees being clocked in or out while helping with their own pets?
Yes. It all depends on what those pets are doing, and why they're taking care. So if again, it happens all the time in our clinics, right? The employees are allowed to bring their pets to work. They have to let their pet out maybe for potty break, bathroom break, and they're clocked in. They're working. And so my follow-up would be you should have a pet policy, employee pet policy in your handbook that says if you are to take care of your pet during work hours, you have to take a break. You have to clock out. If you're taking a 10-minute break, use your 10-minute or 15-minute breaks. Again, if you're subject to them based on the amount of hours that you're working, utilize those breaks to care for your pets.
What if they're
Or
helping,
not?
like, say, with a
Yeah.
surgery for their pet?
They are working. So that is actually them working on a patient, whether it's their animal or not, they absolutely should be paid because they're helping and assisting with the surgery within the clinic and the doctor. Great question.
One
Okay.
more.
Oh,
What employing helping with the Christmas parade? Is it truly volunteer? If it's not
helping.
mandatory, but it's work related, work adjacent.
Like a Christmas parade in a town or a city.
Yeah.
Um, that would be considered working because you are asking them to participate in a mandatory event. So if you are making it mandatory that the clinic has to be part of the parade and you're telling them, all right, Anthony, you need to be here from 9 to 12 to be in the parade. Yes, you have to pay them. If you say, hey, we're going to be in the parade and anybody who wants to come and volunteer that day, they're more than welcome to. If not, that's okay too. You're not making it mandatory. You're just offering it out. If they decide they want to volunteer that day, then they do not need to be paid. If you are telling them they need to be there, it's a requirement to be there from 9 to noon, they have to be paid. Awesome. Scheduling and attendance, perfect segue into here. So, policies and procedures, calling out procedures. What does that look like? We all know that we have surgeries coming in at 7 a.m. We need our CSRs to be at the front desk. Our veterinarians are seeing patients that day. Really, what does that look like from a time side? So, what we're seeing in the industry is usually a 2-hour window. Um, there are clinics that don't have anything written down or that say, well, they let us know 15 minutes before they were supposed to be here. Please make sure you have a call-out procedure, especially for your animal health space, right? And so industry standard, hour and a half, 2 hours is what we're seeing. Shift coverage rules. Sometimes we put it on the employees to find coverage. If they have to change, they know 2 days prior, oh, I have to be in an appointment. I'm not sure what to do. What does this look like? It shouldn't always fall on the practice manager to find the shift coverage. You should be working in conjunction with the employee. Um, Tardiness expectations and no call, no show. So usually it's the three call outs or three no call, no shows, and you could terminate. Listen, they were supposed to be here these 3 days and they didn't show up. All right, they're done. Now, I have clinics calling us and saying, well, they didn't come into work today. They didn't call us, so we're going to fire them. Well, maybe they were in an accident. Maybe they don't have the ability to call right then and there, right? So there's certain expectations. That being said, if someone just doesn't show up one day and then shows up the next, that does warrant a potential disciplinary action based on an attendance policy that you have, right? So if the policy says, let's say, you have to call 2 hours prior and you don't, well, that's an issue. And so you need to make sure you're holding your staff accountable for those attendance policies that you're actually putting in. Um, Operational considerations, urgent care after hour coverage is needed. Again, working with a weekend or rotating shift schedules. So when you're thinking about writing your attendance policies, keep the urgent or after hours coverage needs in mind, your weekend shifts in mind, weather related or emergency closures. You should always have a weather related or emergency closure policy in your handbook within the clinic, especially if you're in the northern part of the country where we get unbelievable snow throughout the year. If you have to close due to a snowstorm, please make sure that you have all of these called out. Best practice, require direct manager contact for all of your call outs. What do I mean by that? Have a point person, right? And so that way, whether it's your practice manager, maybe it's your office manager, maybe it's your tech lead, maybe it's your medical director at times, make sure you have a direct contact or direct manager that employees know that they can come to and know when to call out in the call out procedure. I see a bunch of questions coming in, Megan. Is there anything?
To stay on topic, what's the best practice for paying staff for emergency/weather closures?
If you are closing due to weather related or emergency closures and you have no choice but to close, the industry standard, it's not required by law, but the industry standard is that they get paid because it's not their fault that they weren't able to come in. It's not their fault that you had to close the clinic. Usually they're paid their hourly rate. And I say hourly rate because there might be some shift differentials, there might be some different rates based on work that's being done in the clinic, but whatever they were hired at, if they were hired at $20 an hour and that is part of their job, that's what they should get paid for the hours that they were scheduled to work. You don't need to pay them, oh, we got to pay them 8 hours for today because we closed when they're only scheduled to work 4 hours. No, you can pay them the 4 hours that they were scheduled to work. Does that make sense? Awesome. PTO, sick time, and leaves. So every state is different when it comes down to PTO, sick time, and leaves. Also based on the size of your clinic. So FMLA, in order to be eligible for FMLA, it's 50 employees and over within a 75-mile radius. So most clinics are under 50, but we do have larger clinics, of course, that we all work with and support. But most of the time it's under 50 employees. You really don't have to worry about FMLA. That being said, you have to worry about your state laws, state guidelines on paid family leaves. If paid family leave is in your state, and required sick leave for your state, if that's required. A lot of times we get hung up on or we get questions on, well, can I just offer a one bucket system? Like, do I have to offer time off, vacation, and a sick time, sick bank? No, you can have a one bucket system as long as you are satisfying your state laws. So again, I'll pick on New York. State law for sick time is 1 hour for every 30 hours worked up to a max. So if you're 50 employees and under, 40 hours. Anything over 50, 56 hours. So as long as you're putting it in one bucket and you are satisfying the requirement, you absolutely can have PTO one bucket system. Where it can get confusing is not having that policy or not having it documented in your handbook. And so having that general PTO guidance under your paid leave laws by your state and city. Some states even go down as county. They have certain sick time and laws based on counties. PTO policy should be clearly written when you can use and cannot use PTO, what the rules are about requesting time. Industry standard, we see about 30 days required. Some clinics do 2 weeks. Some clinics don't have anything. But the standard is we need at least a 30-day notice to make sure that we have the coverage. Make sure it's clearly written. And then PTO payout and in language, it is based on specific states, it is not required to pay out PTO. Some states is required. So again, all state specific, but we get asked that all the time. Do I have to pay out PTO? Well, what do you have in your handbook? I don't have anything in the handbook. So it's not a law based on your state because it's not required. Some states you do. When you're looking at accrual rules, carryover, blackout periods, termination payout rules, you all want to include that within your PTO guidance. This time off, benefits, time offs, and leaves are probably the go-to, not probably, are the go-to in handbooks. That's where employees focus on. That's where they want to know, what am I eligible for? What does that look like? So you want to make sure that these are clearly defined. Same thing on leaves. You want to make sure that every leave is called out, from voting leave to military leave to ADA accommodations, jury duty. You want to make sure that it is called out clear and concise when you're looking at job protected leaves for the clinic. Any questions on this? Okay. Conduct and behavioral standards. So professional behavior, you have to make sure you put that in there, that professional behavior at all times. Call out client and customer interactions. Harassment, sexual harassment, workplace harassment, discrimination, call those out in policies and procedures. Substance abuse, especially when we have controlled substances in our clinics, we want to make sure that we have strong policies around substance abuse, and using it in the workplace. And then obviously workplace violence. The two biggest ones here that we see are the substance abuse and harassment and discrimination. You want to make sure that you have those clearly defined. Perfect example. We had a clinic that was going through a sexual harassment investigation. They did not have a sexual harassment policy. They did not provide the required trainings for sexual harassment. The employer lost in the lawsuit because they did not have any of these things in place. The attorney had a field day. The employee went after that, quite honestly, did not commit any sexual harassment, but was fired inappropriately. It was handled very poorly. The employer lost. And it's because they did not have anything covered, from a sexual harassment policy to their trainings to proper investigations. None of that was done. And so they ended up losing and ended up having to pay out. So having those clear policies defined, extremely important. Substance abuse as well. We have seen a huge uptick in substance abuse within our clinics, not only from unfortunately taking controlled substances, but those that are using outside the workplace, and you might not, test for drug and substance abuse in your clinic, especially during hiring processes. You might not have a substance abuse policy that says, hey, if we suspect of some type of substance abuse, that we can do random drug screens, right? So there are these areas and avenues that you really want to make sure that you're covering on in case that does happen. I have on the side here real world scenarios, high stress. I don't need to say any more. High stress in our clinics and emotionally charged incidents. Our clients are at an all-time high with just being very short, and sometimes, many times, can be really tough on our technicians and our veterinarians and all of our staff in our clinics. You really want to make sure that you're handling that appropriately, but also have a good policy in place that your employee maintains professionalism as much as they can. Handling sensitive and difficult situations with the public, and then social media posts and pictures and what you can and cannot post and how do you handle that. So you want to make sure that you have a social media camera policy in your handbook. The world of AI, you all may or may not be utilizing the AI scribes within your PIMS and within your clinics, but having a policy around that and when you can and cannot use it and how you can use it, very important. And it is a must today. It is a must. Any questions? Safety, substances, and compliance. So OSHA, very big on OSHA workplace safety, making sure you're keeping up on all of your OSHA trainings, how to handle hazardous and sharp materials, which just kind of blows my mind that not a lot of training is done in clinics when a new technician walks in, CSR walks in, veterinarian walks in. It's just automatically thought that you know how to be careful, right? No, you need to make sure you have policies in place that cover, God forbid, somebody got hurt or needed to have some additional training, that you have everything documented and a policies of what to do around your SDS manuals and how to handle controlled substances, so on and so forth. What I always recommend is, what does your licensing board state for or say based on your state? What are those expectations? And so follow what these professionals have done all these years in looking at proper training, how to handle workplace safety, and in making sure that that the employees are receiving that training. Please make sure that if they are receiving training, no matter what training it is, and you are requiring them to take the training, make sure it's documented, make sure you get a certificate, make sure they sign off, whatever it may be, make sure it's documented and put into their employee files. It's very important, very, very important. Any questions around this? Confidentiality and records. So I just mentioned around AI, around social media. Um, Social media is very tough because it is considered freedom of speech, and people are allowed to post anything that they really want on social media. Where you do have some say is if the employee is publicly advertising your clinic business, where I am a veterinary technician at ABC Hospital. If they have that posted and they post something really derogatory and wrong, you have the right to say either they need to remove where they work or they need to remove the post. You can't force them to do one or the other. If they don't do either, then that's where law and employment attorneys have to get involved to really kind of enforce that. Most of the time, the employee will do one or two. Um, TikTok has become a huge thing. And before it was Snapchat, I think Snapchat's still active. I don't know. I don't use it. But TikTok is the new thing that everybody is starting to do for their clinics as some, social media engagement. But also, you have to be really careful around policy and procedure to the individual that you're putting in charge of taking a TikTok or making a TikTok and posting it out into the world. So make sure that you have your policies in place around confidentiality and patient records. Please do not post or have people post any surgical activities. I just had a case a month ago where we got called in because they took a picture and posted on their social media of a neuter, and another one of a dental, and another one of a pregnancy, a dog given a birth, and it wasn't caught until another employee reported it. And there was no policy in place to say you can't do that. And they didn't have that. They worked at the clinic. So it's very hard to manage that. Same thing, and this is not so much employee handbook related, but also ensuring that clients are signing off on social media policies and that you may or may not use their pet for social media activity. So make sure you have everything documented. All goes back to documentation, making sure that you're protecting the client and customer data, making sure you have employee confidentiality, record keeping, and documentation, and the non-disclosure expectations all should be in your handbook. Client and employee trust is business critical, needs to happen. Anything there? Any questions? Wow. Okay. Technology, social media, AI, we covered this, making sure that you have business software and systems usage, anything that you are requiring employees to use. So if you are requiring them to use a iPad, a computer, a company cell phone, whatever it may be, that you have that documented and written out that that is what it's supposed to be used for, only business use, not personal use. Same thing goes for personal device usage at work. Put it in a locker, put it in their bag. They should not have personal phones out or personal devices out unless you are requiring them to utilize their personal device for business related, which I do not recommend. Can get very hairy and tricky when it comes to something happening and communication going back and forth. You really can't take their device or request their device because it's not a company issued device versus if it is, you have a little bit more a say and ability to take that device and do an investigation if it ever came down to that. Social media guidelines, AI tools, and documentation boundaries. Again, posting client customer case details, including photos without proper consent, is getting clinics into hot water. And one of the biggest areas that we see very hard to manage because those policies and procedures are not written in stone or in place. Performance management. If I had to do a a poll on who's doing performance management, true performance management, I would guess not many are. And performance management is huge, especially around the increases, your pay increases or merit increases, or maybe they're not doing their appropriate job effectively and efficiently. You might be having issues with employees all year round and then say, well, I'll just wait till I do their performance review. No, that's not a good, effective way to do a management review. For your handbook purposes, calling out what that process is, calling out what performance management is, calling out the feedback process. This is what your expectations are looking like. Progressive disciplinary action, verbal warning, written warning, final warning, up to termination, performance improvement plans. And this is a topic for another day, but what's truly a performance improvement plan versus a written warning, and when each should be used and how they should be used. And each disciplinary action should be followed based on the policies that you have written that are within your handbook. You want to make sure that you're covering all of those things and having clear expectations when it comes down to performance. I put this tip in here: avoid rigid, must follow disciplinary steps that unintentionally limit your at-will rights as an employer. Yes, policies are important. Yes, you should have a policy, but it shouldn't be so specific that you're pigeonholing yourselves into the ability to actually manage the employee. Sometimes I see policies that are so strict, it doesn't make sense. And rightfully so, you have to give the employee the ability to stand up for themselves or justify maybe an action that they did. So while the policies are important, don't make them so rigid because then it makes it tough for you from an employer standpoint to be able to manage that. Okay. Acknowledgement forms. Acknowledgement forms are important. Anytime you have a new handbook, a new employee, a change in your handbook, employees need to acknowledge and sign the form and put into their personnel file. It is a must. If an employee refuses to sign, that's okay. But you, as the owner or manager, have to sign that employee refused to sign on August 5th, 2026. This was provided to him or her, and we are acknowledging that they refused to sign, and you put your initials or sign and date it and put it in their file. That has saved employers, I can't tell you how many times, from if they were to get called out on a lawsuit and the employee says, I never saw that, or I didn't acknowledge it, I didn't agree with it. I know you didn't agree with it, but we did give it to you and we acknowledged that day that it was given to you. So if they don't acknowledge, you can put employee refuses to sign. Most employees will acknowledge it. Most employees won't even read the handbook. They'll just say, just tell me where to sign. And that's it. And that's really wrong because they need to know what they're entitled to and what the guidelines are for the organization. Your handbook should always be available. whether it's in paper format, in a binder, if you use an HR system, a payroll system, making sure it's available on that platform at all times. It should always be readily available if they want to read or refer back to it. I have number two here, digital acceptance option. Absolutely. You can send it via DocuSign, PandaDoc, ShareFile, Box.com, whatever you want to use, as long as it has a digital stamp on it and that you have an audit trail of when that was signed. And then re-signing required after updates. There's some confusion around, well, do I have to have them sign the entire handbook again if I made one policy update? No, you can say we changed our attendance policy and we want to have them acknowledge it. And they're acknowledging that they read the new attendance policy and they put it right into the handbook. If you are finding yourself making updates to your handbook frequently and you're not having them sign off on the entire handbook at the end of the year or whenever you do decide usually before the next fiscal year, you'll want to update the entire handbook so it's all in one. So it's very easy to reference back and you don't have a bunch of policies just shoved into the current handbook that you have in place. Without acknowledgement, policies are hard to enforce. Very difficult to enforce. Questions?
Can you discipline an employee for not signing the policy?
No, absolutely not. It's their right to refuse to sign. The policies at itself. But again, you cover yourself where employee refuses to sign and acknowledge. Usually, if an employee is refusing to sign, there's some issues that are going on and that they're already an established employee. Most new employees or new hires will sign the forms at date of hire. You can real quick, you can, if someone doesn't want to accept their job duties or new job duties, or if there's changes in the clinic, or if you hire somebody and they don't sign the job description or offer letter and they want to come to work, you can stop them and say, until you acknowledge and sign off on your offer letter and your job description, you can't start, or we will rescind the offer. You can do that because that is a requirement for you as an employer that you want to make sure that they're acknowledging what they're getting paid, what their job's going to be, what their hours are required for them. And if they do refuse to sign, then you can rescind that offer.
Okay, but for policies, even if they don't sign, they're still required to
Still
adhere to the
required.
policies.
Absolutely.
So,
Yeah, they're still
okay.
required to do it. That's why having that, employee refuses to sign and you acknowledge it, they're still required by your employment policies to follow. So always a little defiance there when it comes down to that. Any other questions?
We have a few that trickle back, so I was going to wait
Okay.
till you were done.
Yep, we're almost, how we doing on time? Oh, we got 5 minutes off. We're almost done.
Yep.
All right, common handbook mistakes, no written PTO payout rules, misclassification of employees. Huge. That is like the biggest. Misclassifying employees, 1099s versus W-2. I won't go down that rabbit hole. No overtime approval policy, weak or missing social media policy, and then safety and compliance protocols. So ask yourself, when was the last time your handbook was updated? Again, I like annual. I think if your handbook was updated within the last 2-3 years is pushing it, I think you're okay. But I get compliance updates on the daily, and every state is updating leave policies and what's required by state. So make sure that you are at least putting in those addendums. Key takeaways: handbooks protect the business and its people. Consistency beats complexity. Policies must match real day-to-day operations. You can't just put a policy in just because, oh, I want to make sure I'm covered. No, make sure it makes sense for your clinic. And then managers should and must enforce what's written. That is important. So make sure that, out of everything, and document. Any questions?
A few that came through. Recommend an attorney review a handbook?
You can have an attorney review a handbook. I do think it's important. We have attorneys that we partner with, so all of our handbooks that we develop and create get the final A-OK before it's sent over to a clinic. It's not necessary though. There are platforms out there that will build a handbook for you. Again, be careful because a lot of it's AI driven today, and there's nobody reviewing it on the back end. So just be cautious when you are using a platform of such to create that handbook.
Thank you. Best practices for paying staff. We talked about the weather closures. Does it change if it's multiple days? Do you change your opinion on paying?
No, not at all. No, it's because if you are requiring or if it's mandatory or you're without power or whatever it may be, snow's 8 feet tall like we are in central New York, you should still pay for what the scheduled hours are. We
Okay.
get questions all the time. Well, can they just use their PTO? If you don't want to pay, you can give the options to the staff. You can either go unpaid or you can use your PTO time, but you can't force them. It's always good to ask them and then have them acknowledge that as well.
Okay. Perfect. The back to paying someone to take care of their pet. Can we say, hey, we only take care of your pets on your day off and then not pay them? Or somebody else takes care of the pet and they don't get paid to take care of their own pet?
So bring your pets in when you're scheduled for day off for like surgeries or whatever, and
Hmm.
you can. I mean, there's no law around that you say that you can't. But I do know that there's this level of comfort knowing that, all right, my Stella has to go in to have a neuter done, and I want to make sure that Stella's being taken care of appropriately. It really is all depending on the comfort of the employee as well. But yeah, essentially you can. Yes.
Okay. Okay. Last question. Many handbooks leave out staff accounts and the repayment of accounts when they leave or get fired. Is that if we put it in the handbook, does it make it so? Does it help?
It helps a little bit because they are acknowledging that if they were to leave and they have a balance with the clinic, that they have to pay it back. Please do not withhold last pay. You cannot do that. Most states, if not all, you can't do that. I know there's a couple exceptions out there. I think Idaho is one of them. But you do not want to do that. If they've worked, they need to get paid for the hours that they are worked, and then you need to come up with an agreement of how they're going to get paid back. You can also, if someone's leaving and they have a balance of $400 when they hand in a resignation letter, which everyone should, when they resign, you can then say, okay, Anthony, you have a $400 balance. How would you like to settle this before you leave? Do you want me to withdraw it out of your pay? Great. I'll have you sign a form saying that you approve me of withdrawing and making that extra deduction out of your pay. Or do you want to just pay it on a credit card? Do you want to use care credit or whatever, you might have in the clinic? As long as they sign and acknowledge that you are withdrawing or however you want to pay, that's all that matters.
Perfect. Okay. Anthony, amazing as always. I know we all took a ton of notes. If people need to find you, have more questions, what do they do?
They can reach out to me directly, Anthony at gowithempower.com. Our website is gowithempower.com. By all means, feel free to reach out at any time, even if you have just a general question and you want to make sure you're on the right path going forward. More than happy to help. And I appreciate you all having me this afternoon.
We appreciate you. And this will be on YouTube too. Also, if anybody
Awesome.
needs to come back and watch it. So thank you, Anthony, for sharing all
Welcome.
of your knowledge. We appreciate you.
It's good to see everybody. Thank you so much.
Thank you. Bye.